Welcome, everybody. We'll give everyone just a few more minutes to log in. Welcome, everybody. I'm just giving maybe another minute. There's 1 to 2 more that may be logging in, but thank you for being here. Okay, well, I'll just start sort of giving my little beginning spiel. But first, I would just want to thank everybody for logging in and being here today. As you know, I'm Jamie, and today we have an awesome guest here to talk about men's health. And Dr. Levy, Dr. Desi Levy, who has helped with presenting some previous health-related topics, was wonderful to connect me to Dr. Bashir Easter, who is here from the UW-Madison, University of Wisconsin-Madison. He is the Associate Director of the All of Us Research Program, and he does work here in Milwaukee as well at the Center for Community Engagement and Health Partnerships. So I will hand it over to him in just a moment, and then I will also say if you have questions, please feel free to type them in the chat. And Dr. Bashir, I'm happy to interject and ask them, but I also think that maybe it would be okay if since we have a smaller group today, and Dr. Bashir, you can correct me if I'm wrong, but maybe if someone has a question, they can just go ahead and ask it. Okay, excellent.
Yeah, that works.
Awesome. So again, thanks for being here. I'll go ahead and let you take it away, Dr. Bashir. Thank you.
Hello, everybody. Thank you for taking this time with me today to share a little bit. Yes, my name is Dr. Bashir Easter. I work for the All of Us Research Program. I'm going to talk a little bit about it, and if you can, utilize your system. How many of you know about the program? Raise of hands or shake of hands, nod, or any of that? All right. So the program started in 2015 under the Barack Obama administration. It was designed to be able to find out why people get sick and why people don't. It is a thought of or concept is called precision medicine. So I see some of you have glasses on. that you wear. You have your pair, I have mine. I can't wear yours and you can't wear mine. They're precise to me. And medications and treatments at this point have really been tested on middle-aged white men, and that we're all taking these medications and taking these doing these treatments. And we're really trying to find out things that are tailored just to us as an individual. So the program is looking to enroll 1 million participants into the research to be able to find out if there's some of that information that you give, which will be your blood, your urine, your height, your weight. That information will be utilized to be able to find medications, treatments that are designed just for you or for your children or grandchildren. What it is looking at is a few things. One of the things that you do get back is your hereditary risk information. That's with your DNA. So you get 59 gene DNA sequence about that to let you know about what's going on with you, particularly that is from your lineage of your mother and father and before. What you get back is 7 genes of your medication sensitivity. That will let you know exactly some of these medications that you may be taking. You'll get to the point of understanding if that medication does not react well with your body, whether it does absorb well or that. That's the kind of information that will be shared with you as well. You also get your ancestry information that comes back to you as well, and some fun facts. Fun facts being like earwax. If you like if you taste cilantro, they taste like soap, or does it taste like cilantro? Why that's important is because a lot of this information we don't know. You get $25 to enroll in the program, which we believe is not enough. So our focus with this is that we have a consortium group in Wisconsin, and I'm with the UW, located in our office in Milwaukee, but we also have the Medical College of Wisconsin that's with us, our Gunderson, as well as our Marshfield Clinic that's in the upper north that rounds out Wisconsin. We're the 9th state to be a part of this national program. And if you get a chance, take a look at the joinallofus.org. Why am I bringing up regarding the men's health, right? We're having this discussion. As we started moving this program into the community, started in 2018, something shifted in my brain. I started realizing and understanding that the information that we were getting back was data that the community did not have. We got to the point where we wanted to focus on men, African-American men and men in general, to be able to understand their health at a better level. So I started a group of men. It really was very organically formed of a few men that I connected with at the barbershop. And as we had these conversations, it was like, I have some information and I have a few dollars, would like to start talking about men's health in general and trying to get guys together to have that conversation. Mental health was one of the components that were being discussed. There's a playwright that I got in touch with named Garrett Davis, who had did some education in regards to entertainment. Like some of the plays he would actually bring. He has some called the Forget-Me-Not plays that talked about Alzheimer's disease and an African-American family and some of the struggles that came along with it. And he had 2 other plays that he did was called Daddy Girls and Daddy's Boys. Well, the play that I was able to, with the university, was able to get information from him was that was called Daddy's Boys, and it focused on mental health and stress in the African-American men, and to find out how did this family deal with that in the capacity of getting services and supports or counseling. When I went to actually get together with these men, it was about maybe at that time, maybe 15 men to come together. I met with the gentleman, his name is Pastor Locke, with Unity Gospel House of Prayer. Also met with Robert Jackson, who Raise the Bar, and Clem Richardson, who works with Men Up Behavior Services. We got together, got into a building to be able to bring these men together to look at the film. And before we did that, I had Julia Means come in, who is a nurse that came in, as they call her the nurse, came in and was willing to do blood pressure checks on the men. So we did that. They came in, they sat down, they did the blood pressure checks. We sat down, and before we even got into the conversation of watching the film, there was a moment to ask the men, the numbers that you have in your hand, do you understand what those numbers mean? The top and bottom number of your blood pressure. And 2 of those men out of the 15 to 16 men raised their hand. At that point, it was a different conversation. The information that they received in their hand could lead them to say a few things. I asked the men, if you don't know what those numbers mean, how many of you are going to follow with your doctor to find that out? None of them raised their hand. I asked them if any of you even going to Google this information to find out what those numbers mean and how they're impacting you. And none of them raised their hand. We realized we had a huge issue in regards to just that. And that began the push of men making health a priority. That's been going on from the end of December of last year and continues on the last Friday of every month that we get together to be able to do just that, to talk about three main components of men: mind, body, and spirit. And understanding that these components are trying to get to understanding why men don't make their health a priority. What we learned so far in that conversation, we have a few women and a few men on here, we realize women have had a quicker access or a immediate access to a healthcare provider at an earlier age than men. Realize that men usually find out about a doctor is either because their mother has taken them to the doctor because of a cold or some issues or a broken bone or something like that. But the real part where a man takes a moment to figure out if they're going to need a physician to give them some assistance is when they're going to get ready to play sports. And they go into that doctor and they give them the check and ask them to cough. That is the beginning conversation that a man is going to have with a doctor, and generally they don't have a conversation with the individual again. But our women, they actually go in and they're going to be checked at that time with an OBGYN at the point where they're going to have their menstrual cycles and being told that you need to make sure you stay connected to your doctor. The women embrace. There is some things that the men are also recognizing, that the men in their mind don't trust their physicians or doctors, but not wanting to do anything with that to find another doctor. And the other thing is that the men recognizes they don't want to know what's going on with them. They walk around in the capacity of just guessing. What we also noticed with the men, there was a high impact of mental health and stress. The understanding of what they were going through with depression, did not name it depression. They did not cause the things that they were going through as issues. They were saying that they were having maybe a down day, or they just need time to relax, or they were just going through stress, but did not understand that their body was physically going through a manifestation of stress, but not having a conversation on how to relieve that stress. The other thing that was going on with the men is that they were the highest of these men. They're recognizing that the individuals were high on risk of high blood pressure, diabetes, prostate cancer, colon cancer, and that the men were dying at a higher rate, and not understanding these things are preventable. And I see in the chat that some say that some men prefer men. In some of those cases, the only doctors that they had were the ER. They didn't even have a primary doctor. So I agree, there are some scenarios that men only prefer men, but in reality of some of the men that we're having in a small group that we're discussing in a larger group, the only preferred doctor or doctor they had was an ER or urgent care visit. So in that conversation of these men, as we started to discuss more and started to peel back some of these layers, we never even got to watch the film that day, because the men started to be able to communicate, started to talk. They started to open up about a plethora of things. And at that point, we realized is that we didn't have enough professionals in the room to be able to address some of these issues that the men were coming up with. So the focus was to get the professionals in the room. The second session, where we had the professionals in the room, we had an attendance of about 15 to 16 the first time. We had an attendance of about 30 to 40 the next time. Once we got the professionals in the room, we went down to 5. We realized that the individual of the men, and we came to accountability, started to get lower, because things started to come out, they started to share, and the accountability of that, because we started to then ask for a certain accountability, it changed in their mindset of, do I really want to do this or not? So we began the push to say, what is more important than you and your health? Over and over again, we asked that question. We asked the men to take 2 hours and the sessions that we have to shut down everything else, getting ready to prepare for somebody else, getting ready to prepare for the next day, making a meal, whatever you were thinking about, working on the car, whatever it was. We asked the men to take 2 hours for themselves, and it was extremely hard for those men to do so. We started off with the body, and I explained to you what we did. We had 3 months of the body. We asked that we actually brought in a coach, a workout coach, to come in to be able to do physical workouts in the room, and we were able to do it hybrid. Individuals were able to do it in their home, and they were also able to do it in person. We did also had a vegan chef come in because we realized whatever we are doing on the outside of our body, we need to make sure we know what's going in our body. So we had to look at what we were actually doing in the intake of foods. We brought in a vegan chef, and I'll explain to you why we did that as well. We continued on with more exercise in the third go around, and that was the 3 months. And then we moved to another 3 months, and we're focusing on the mind. What we asked the men to do is for the accountability piece is we said that we want you to do, before we get into the discussion of, because we're going to ask the men to be a part of the DNA component to learn more about themselves. That was too far. So we asked the men to now focus on one main thing that you can do right now is to be able to do your metabolic and lipid panels. And what is that? So it's your blood work. It's to be able to tell you what your A1C is, your cholesterol. We wanted to, you get an understanding of what is going on with your body at a baseline of time. So we had the men to take accountability of that. Some men did it, some men didn't. We took the barrier away of the cost. Didn't have to go through your insurance to do that. We had our doctor, Kevin Izzard, was able to provide a process for these men to go through and get their blood work done, to get their information back and actually being read off to them. What we noticed is the men, number one, some had primary doctors, some didn't. We took that away. But the issue is that some of the men didn't want to know, or some of the men already knew. So we had to give them something to be able to help curb that. So 3 things that we asked them to do. One, we asked them to change their eating habit. I had stepped in and said one of the things I was going to do in regard to my eating habits was drinking water. I stayed and said at the dinner table, at the home, anywhere I went, I changed my whole liquid intake to water. No more sodas, no more juice, no more milk, no coffee. It was water. The second thing I did I took out red meat, took red meat out of my diet. And the last thing I did was I took bread out of my diet. The reason why I did those things is because when I did my levels, my triglycerides were to the roof. And that one of the things they'll talk about the foods, the cholesterol, and the main thing they had to do is to stop eating a lot of greasy foods and fatty meats. So I had to take that out of my diet. The other thing was to be able to exercise at least 3 times a week, to add exercise to yourself. And the other thing is, of those 3 things we asked the men to do is to do this for 3 months in increments and to retest to see if there's been any changes. We started the 3 months I told you, with the physical activity. Got to the next 3 months to talk about the mind. And what was very clear is that even though we put in all of these things to help reduce some of those barriers, the men still felt that their health was still not important. To even make some of those small incremental changes. So then we realized the issue it was the mind. It was the way we think. It was the way we process things. And it really made the men to understand that there were a lot of things that happened in childhood that were even told or taught or said to us as young men that still impact us at our older age, that we still hold on today. And those things that we're doing at the same time, we're teaching it to our children. Generally, what we also learned about from the men is, you know who actually makes sure that we are taking care of ourselves? Who would like to raise their hand?
Women.
Women.
Yeah.
Moms.
Moms.
Wives. Yeah.
Wives. You are the ones that are actually pushing and driving us to make sure that we take care of ourselves. We say and we do everything we can to take care of our family, making sure we go to work, make sure we are providing, doing all these things, but not recognizing that the main thing we need to do first is be selfish. It's to take care of ourselves first before we take care of others. There's an analogy that I use in the trainings and the conversations with the men is I use this conversation of being on the airplane. Get on the airplane. I know we've all been on one. Get on the airplane. The stewardess gets on. Sometimes I listen to her or him, and sometimes I don't. But when I do, I usually hear the same thing. They tell you where the exits are, right? They tell you the bathrooms are going to be here, there. The doors are on the other side. They also say something that's very clear. They say there could be a time where the plane will lose oxygen, and you'll see something will drop down out of that the top there, and you're supposed to grab it, and it's a mask. And they tell you when you grab the mask, what do they tell you to do? Anyone would like to tell me what they would say?
Put yours on first.
Put yours on first. And what is the reason for that, Kathy? Let me see. Any of the men on here? Let's see to get some of the men to talk. I think our men just stepped away. So, Kathy, what's the reason why they're asking you put your mask on first?
Because you can't help other people if you don't help yourself first.
The oxygen that is flowing, that is no longer flowing, is only going to be flowing through the mask. And we are all human beings. And one of the things that we need, just as fire, it needs oxygen. And as soon as there's no oxygen, there's no help. So if you go to continue to help others and you have no oxygen for yourself, you will pass out. You probably not be able to help the person that you say that you want to help and that you care for. So some of those things, as I say, usually it clicks, but it continues on, because this is a generational situation in regards to men taking their health as a priority, because it's something that's not in the forefront of their mind. We think we're invincible. You know, we think that since we lift weights or we played sports or we were young, that we continue to do that. And every time, I have not met one man to this day that the body does not tell them that there's something going on with them. The difference is that we ignore it. The difference is that we keep pushing past it. The difference is we'll just continue to feel like, oh, that's an ache here and an ache there. And the reality is those are all signals that your body is saying something is off. So what we're looking to also do is to build a partnership with the individual, the men, and their physician and doctor. We say if your doctor is not on your team, if the doctor is not someone that you go to and have a conversation with about everything, and that you can trust that person, whether it's male or female, and have that conversation, then you need to fire that doctor and you find someone that you do trust. Because the more that you continue to push things past, you're missing a lot of preventable things that you could take advantage of instead of leading it into a crisis situation. Before I keep going, does anybody have any questions so far or thoughts?
I have a thought. I just appreciate the sentiment of making you and encouraging. I know you're talking specifically like to men or about men, but having a relationship with your primary care provider, your doctor, where it's communicative and reciprocal, like supportive. I feel like this is something I've learned as I've gotten older, is that like my doctor, yeah, they may, be a doctor and they know a lot about the body, but also I know my body too. So thank you for saying that, Dr. Bashir.
Yes. The other thing is, knowing your body, you're supposed to be the best person to know your manual. It's your body. You should go into the doctor's office and explain to them, this is who I am. These are the meds that I cannot take. These are the things that I'm allergic to. This is all of the issues that I've had in my past, from younger to older. Here are the changes that I've noticed in myself. The doctor should not have to do a bunch of tests to be able to then get an understanding of what's happened. You should have a true understanding, a baseline of you. We're asking the men to take another step while I'm going into the DNA component. The All of Us program does give back your DNA. That DNA was a snapshot, one snapshot of you. This is information that you should have known a long time ago. We all should have known, not just the men. But that DNA snapshot is where it is now you have a true blueprint of how your body ticks and any hereditary issues that actually is now attached to you. I let the men know that there are a process where we talk about generational curses. And that reality of it is that there has not been a lot of information being passed down, whether they're able to do it or weren't able to do it because they did not pass down or transfer that knowledge to the next generation of health. And what that does is it leads us to walk around in these bodies with a half of our mother, a half of our father, a whole of you and your experience. And you are walking around and not knowing the manual of this machine. And so we're steady putting the wrong gas in our body, right? Just like we talk about a nice engine. That's how I talk to the men. You have a very nice car and the vehicle says, and I think gas is the wrong analogy with it being so high, but you put in the unleaded instead of the premium. And your vehicle runs on premium because it is built off of a high octane. Well, we've been putting in the unleaded for so long and it's causing the clunks, and we're just used to going and clucking on, and we're not reaching our full high potential to the point where then the engine seizes up because of some of the issues, and you have the manual right in your hand. And we're getting to the point to have the men to make sure they have a manual on their body. The DNA piece that they will receive back tells them just that. There's a geneticist that we'll be working with that will explain what DNA is, explain what it is for you as an individual, Once these men are equipped in understanding themselves at that cell level, the whole point is to now take that information and pass it on to their children. And to have their significant other to be able to also get that information about themselves or prepare to, so they have a whole understanding of themselves as a family as they continue to move on. I use my daughter as an example. My daughter I got to a certain age, she was doing a lot of fainting. It was out the blue. We thought truly was because it was hot. We were at Six Flags Great America, and we were, ironically, we're heading to go on the water park area, the logs, that's what it was. And she got at the top, and they called my name, and I saw her, and we had to rush her down because she fainted. I truly thought it was because it was a very hot day. It was hot, but her body wasn't regulating. Didn't know that, right? We fanned her, got her some water, taught her to tell her to sit down and relax. It was too much for her to deal with. Did you eat? All these different things. Well, further down, she was fainting, some more fainting spells. So we finally took her to the doctor. The doctor started to do some tests on her. They did all these different things. And my father, being very transparent, me and him, we were just now starting to have a better relationship with each other, but really didn't communicate it now because he didn't raise me. And so there's a lot of pieces of health that I did not know. Well, there was just one call I had, and we were just discussing what was going on with my daughter at that time. And he said to me, he says, have her tested for POTS disease. And I was like, what? Have her tested for POTS. And I was like, well, what is that and why? He says, because your sister also has that fainting. It runs in our family on my side. I would have never known. But it definitely didn't hit me, but it hit my daughter. And so this is the kind of information. And sure enough, we went in and had her tested, and that's exactly what she had. Now, it can be regulated with medications and stuff like that, but what the disease is, it doesn't allow her body to regulate during certain hard heats and stuff like that. So she had to be very mindful of certain things that she was going through. But the sadness of all of those components are, as we talk about it, is that we're walking around with information from our family. And we're going through things and we think it's just normal. And reality of it is that it's something that you should have known a long time ago to prepare for. And so we also teach the men to be able to get this information, this data, to prepare and understand it, and also be prepared to pass this on to the next generation so they know themselves the exact same way. This data and information that I'm very aware of is not normal. So first we want to make sure is that the individuals understand their baseline of themselves, their blood, their cholesterol, their A1C, and all those components. And then they regularly get those checked. And then once they know that information, what can they do about it to regulate, to change? So their eating habits, exercising, those type of things to help deal with those main physical things. The next component is the next level, is the DNA, to get these men to be aware and understanding how to use their DNA to have a complete view of themselves. So that's the body part of it. Any questions about that or thoughts? And I'll then talk about the mental, the mind in the next moment. No? All right. So the mind, we talk about mental health. Mental health is probably the biggest mystery in regards to men as we start talking about how the body deals with. We can deal with some of the physical pieces, ailments and stuff like that. But when we talk to the men about the mental stress and all of that, a lot of things started to come out. What was being known and being shared, and some of the men, as a majority of the men or all the men are African American, is that they're carrying a burden of stress as from being a child. Let me explain what that means. Because of this society, because of the way things are with racism and discrimination, African American men wake up and walk out truly with a target on their back. They walk out with an idea of stress and issues that do not impact our African American women the same way, and our Caucasian brothers and sisters and any other racial group the exact same way. And we actually hold on into this information and walking and toiling each day. And we actually continue to carry that on our shoulder. The next day when we get up, what we actually do, we keep the same burdens and issues on our back, and then we walk out again and we add more that comes to us every single day. So this has happened from childhood on up and continues to this day. We have not been able to unpack. We have not found ways to unwind. We have not found ways to release stress. And the mental part of it is understanding that it's a chemical changes in the brain. That's the other thing we have to make sure that they understand. This is a chemical change. So we talk about the physical changes. We're talking about the chemical changes in the brain that has to do with releasing information, releasing the endorphins or cortisol in our body to be able to deal with some of the things that are going on with us. And a lot of times when we talk about mental health and stress, we do not seek avenues to be able to get help, services, or supports from someone else to relieve. That's why the barbershop is sometimes very important to some of the men, because they go there to talk about a lot of those things. The other ways they look to relieve stress is just sometimes with another male, but they do sports or find other things. Some individuals also look at church as being or faith-based community, a way to connect to, a way to release some of the stress in regards to what's going on. And not understanding that in some of those cases, we need medication to help baseline us because of the mental things that we are going through, because it's such a taboo, it's such a stigma that's associated when we talk about the mind. And so a lot of those discussions is to be able to break down those walls to let the individuals know that we are all human beings. And if we do not take care of those things, take a moment, a snapshot of you today, and see if things are going the way you want to. And 90%, 99% of the men say they're not. And so the goal is to say, let's bring in these resources and these services to help you make a change, to see if you can now see what works and doesn't work for you. So we've been doing this. This is the full year of us focusing on making men health a priority. There's a radio station on 101.7 with myself and Dr. Ken Harris that comes on every other Saturday that discusses. We have a few guests that come on to talk about these things to help the men understand about their health and how to fix those things and what are the things they need to do to connect. And they're on podcasts. So if you wanted to go on 101.7 in the podcast, The Truth Radio, you can get those podcasts to listen to those. We also have the men to come if they're interested to come to the Men's Health Night on Friday evenings from 6 to 8. They're at the Ogberg Building, and I can actually send that information to you all as well if you need that. The other thing that we're focusing on is if the individuals are interested in the part of enrolling in the All of Us program, not just the men, but anyone even on here as well. That information is also something that you can utilize as well. It is very paperless. You can go on and do your own research and join allofus.org and do your research about that. We encourage individuals to read up on it. And if they're interested, they can talk to me or the Medical College of Wisconsin and enrolling into that program. The part that is so important that I have shared with everyone, as I said, that day that something clicked, it was the data. It was the information. It was the information that I had not had or would not have had in any other capacity if it wasn't for this program, would have brought it to my attention that it was a need to have it. So my physical, my DNA, my ancestry information, that is information that we should all know right in the beginning. It just as they're teaching in school about your health and about the reading and different math and reading and writing and arithmetic, you should know about your health as well. And this should be built into that capacity to build yourself up longer. There was one individual that shared with me in one of the men's group that they had a test on him. I think it was at 18 that talked about a valve in his heart, and he talked about the centimeters of where the valve was, and he was retested. He is now at 55, and they stated to him, we have some good news and bad news. We do notice that these are some things regarding your heart test that we notice your valve is at this centimeter. He said, well, what was the centimeter before? And he said, what was the centimeter that you told me? They said it's at a 6. And he said, well, I'm glad that you told me it's at a 6. And he was like, well, why? He said, because at 18, it was a 10. So he had a baseline of his understanding at 18, what was going on with his heart. And then he took all these precautions and did everything he needed to do. And it actually now is a 6. That is data that he should have known a long time ago, which he did. And we try to let the men know as this is the information you need to know now to do better with yourself as you move forward and not be afraid of it, because they can be very preventable and things you can do to help yourself. So I'm glad you allowed me all to talk about the men's health and to explain a little more about what we're trying to do. We definitely understand that men are unique creatures, but one of the things that we need is our our love and support from our family to help continue to encourage us, because in our mind, we're supposed to be doing the right thing to make sure everybody's okay. And we need somebody to tell us to be selfish and take care of our health. And so and anything that you all can continue to do to push that, we appreciate that. So we understand that we share that with our loved ones to continue to do that to help us move forward. But there's a lot of work that still needs to be done. And that's what I have.
I just have one quick question.
Sure.
Do you have any advice on breaking down the stigma around getting counseling and mental health for men? Because men are notorious about, I don't need that, I'm fine kind of thing. And I personally feel that everyone on the planet could probably use counseling of some sort or some kind during their life, but men are just, how do we help them break that stigma?
So we have to normalize it. It has to be a normal discussion. And the only people that can help normalize that, Kathy, is other men. That's it. If you have a few men that continue to talk about it, even refer whoever they're seeing to another man, is more of a chance for that they will do it than someone just saying, go out and find someone to talk about your issues. It's not going to happen.
So just like,
go ahead. I'm sorry.
So just like doctors, would you say that men would be more comfortable talking to a male counselor versus a female counselor?
I can't say that overall, but yes, I think a lot of the times when we are in a circle, it's called vicarious learning, and that came from Clem Richardson. He's a licensed counselor. He said in his therapy sessions, the majority of the time when the men will have a conversation, and this has been seen in our events, is that the men will talk more in a larger group as they see other men are sharing than they would do a one-on-one session. And in that larger group, we heard it all. The first session we had, we were just looking at the film. We didn't even get to the film because the men talked about every single thing. I mean, they started pouring out. Some even started crying. I am not a counselor or a therapist. And I knew that those individuals, once men open up, you either get them the help they need or they're going to close back up and not open up again. So we had to hurry up and try to get some services in place. And now we're more equipped and prepared. But that's something that definitely needs to understand is get them in a group. Start having the dialogue about some of the things that they need to know. The other thing that they needed to make sure is that the men need to be heard and they need to know that they care and it needed to be a safe place, safe environment. And once that was put into place, that mix, they began to get out. So then it's encouraged to say, okay, the next thing is we want to set you up a session, right? Set your session up with someone to have this conversation, take away some of these barriers. But realizing the part that I think even some of the therapists even said, there's so much to unpack. It's like, we got to start somewhere, but they're coming with a lot of baggage for a lot of years, even down to childhood. And some of that was instilled that we learned was they said that men should not cry. Suck it up, be tough, right? That is a thing that now men feel like if they do not cry, or if they cry, then they are considered weak or considered not able to handle the situation or soft. And not understanding crying is a mechanism for the body that was created to release pressure. We look at it as just emotion. The body is actually releasing it, and that's the way that it is. It releases it. If it doesn't release it, it stores it, and it pents up, right? And so these are the things that we try to get the men to understand how it physically you feel, what it does, and then how to unpack what that looks like. And so we help them get connected to their EAP programs that they have with their employers to make sure that they are connected to these services that they can right away. And then we hold them accountable. We come back and ask them, did you have a session? Why? Tell me the reason. And we go right back to, why are you not taking your health as a priority and putting it right back on their plate? And everything that they bring to, we tell them it's an excuse. And then we get to the point is, do you really love yourself? We tell them just like that. And so you can say everything you want. It's like, now it's time to be selfish. With this, be very selfish. And so it takes time to over and over again, we push it because everything else is more important than us taking those moments. Okay? And mental health is at the top of our issues for men taking next steps. So.
And I think that's very generational too. If you get men that are able and willing to do this, then that will trickle down to their sons as well.
And that's what we tell the men, is to say, if you understand that you need this for you, you also understand your children need this as well. So you do what you said you want to do and make sure everyone's okay, take care of you, and then now transfer this to your sons and your daughters. They're a different generation, but they still need to understand what these services are for and why it is important for their machine.
Great session. Thank you so much.
You're welcome.
Yeah, thank you so much, Dr. Bashir. I don't know if you just saw it coming into the chat, but I am struggling. Sorry. Someone said that okay, I'm sorry. Why? Technical problems on my end. Yes, thank you for sharing this valuable information. I really appreciate it. It was informative. Definitely feel more comfortable and gain knowledge to be able to share what I learned. Thank you for saying that, Sana. I agree very much. I do have Dr. Bashir, I guess, would you be willing to share, and I can like send you an email separately, but maybe some resources or links. I know I wrote down the All of Us research program website, but I know that I'm thinking about there's a person who's working on family engagement at Nextdoor that does a fatherhood initiative, and I feel like this would be a really good program for her to know about and be able to pass on to the fathers that we work with. Okay.
Yeah, and the goal is to do whatever we can. Each initiative that's out there to be able to target men is very important. We're not trying to be the all of everything. Again, this was really created very organically. As I started to pay more attention to it, I was created, I think, to find gaps. And so it wasn't something that I was looking for, just something I noticed. And then after they weren't able to explain about those blood pressures checks, it was very, very evident that we had a problem. We then had Julian Means come back a second time. And this is what happened. I'm glad you brought this back, made me think about it. This is very important. She came back and she did the checks again. And then she explained what the top number and the bottom number meant. And not in just a medical sense, she made it visual. And this is exactly what she said. She said the top number is how you talk about the heart is beating. Mine is beating and pumping and going and going and going and going. That number is important. The bottom number is the most important, because the bottom number tells you when the heart is actually resting. When in those beats, the heart is not resting and it's constantly firing, that's when it's high, is where it's a major issue. When she explained it in that capacity, the men, all of a sudden, they lit up. They understood. They say, you want your body to be able to have a moment of rest, to recuperate, to go back and do. And if it's not, that's your issue. So the men started to actually run back. This is true. Started saying, can you check me again? So it's not just the information that is given, it's how it's given and how they actually understand the information that's given to them. Because we also have a conversation with medical professionals, is that you may be giving information at a level that is too high or too technical or too wordy, or however you want to do it, that's causing people to be like, it's too much for me to understand. I don't want to do it. And then they push it away and not absorb and understand this is about you. So we also have to let the medical community understand that you have an onus as well to make sure even the amount of time you have with your patient, male or female, that needs to be the best time you have with them. Is it 15 minutes? You do need to do a lot of listening and be prepared to answer as many questions as you can. If you can't, you better be ready for a follow-up or someone to get back to that person, because I guarantee they're going to leave. And the next time you see them again, they're going to be worse. So we do round. They have grand rounds I've spoken to with Priva Health. It's in Green Bay, and have conversations with them to be able to talk about some of these things regarding men's health, what they need to do and need to be prepared for to be able to reach the community, because the gap is too wide why they're not taking on these services. or help.
I think that's a great point too. I think the doctors need to meet us
Mhm.
where our understanding is.
Absolutely.
Because it can be very intimidating if you're not understanding anything they're saying.
right.
So
That's right. If there's any more questions or comments, that's all I have.
Awesome. I'm not seeing anything come in.
Okay.
Thank you so much, Dr. Bashir. This was a great conversation. I will follow up with you just
Okay.
with some resources and making a connection internally here at Nextdoor. But again, thank you so much for your time. Really awesome to learn about the work that you're doing. And yeah, we appreciate you.
Thank you all.
great. Thank you.
Thanks everyone for being here.
Thank you.